Good day. My name is Douglas Bailey. I'm one of the founders and president at Levram Data Technologies, a software company based in Corvallis, Oregon. I want to thank you for coming to this tutorial video for our COVID-19 staffing simulator. We hope this video will help you understand how to use the tool to predict the pandemic's potential effects on your citizens and your workforce. It is our honor to be able to provide this resource to you and your departments during the crisis, where there is no charge for it. And we look forward to feedback. Thank you. Welcome to the tutorial video for Levram Data Technologies COVID-19 Staffing Simulator. We hope this video will help you understand how to use the tool to predict the pandemic's potential effects on your citizens and your workforce. It is our honor to be able to provide this resource to your departments during the crisis. To begin, navigate to https://covidsim.levram.com using Chrome, Microsoft Edge, or Firefox. At the bottom of the screen, there will be a disclaimer which explains our thoughts behind creating this tool and some of the sources of information we used as a basis for it. To read the disclaimer, click the word disclaimer. You may also accept it without reading it and continue by clicking the X on the right-hand side of the banner. You will then be presented with the application, which starts in the Daily Data View. The Daily Data View is the initial view of the application and allows you to plot different pieces of data on a chart in order to see how the crisis may affect your staff and the population they serve. The left-hand side of the window contains the chart, and the right-hand side of the window contains a set of controls you can use to modify the simulator setting. The settings are retained between visits to the site, so you will not need to re-enter them if you navigate away from the simulator and return at a later date. We will now briefly discuss each of these settings. For more information, please refer to the Help page available on the toolbar at the top of the screen. The chart itself plots different measurements on the y-axis and the number of elapsed days on the x-axis. For example, with the default settings, we can see that there's a peak number of 162 COVID transports on day 73 of the outbreak. At the top of the settings control is a presets dropdown, which allows you to select from several scenarios we have put together that represent different potential progressions of the disease. These do not represent any specific scenarios observed in the real world and merely serve as suggestions for you to experiment with. The first setting is the service population setting, which is used to define how many people live within the jurisdiction you serve. For the purposes of the demo, we will use Benton County, Oregon, and set our service population to 93,000. The second setting is the transport rate setting. This setting defines what percentage of your service population who contract COVID-19 will require transport to a hospital by your EMS staff. We will leave this setting at the default of 5%. Notice that as we change these settings, the values displayed on the chart update automatically. Third setting is the attack rate, which is used to determine what percentage of your service population is likely to contract COVID-19. This is a highly variable setting and is affected by how aggressively your city and state are implementing stay-at-home orders, social distancing measures, and business closures. You will need to discuss what an appropriate setting is with knowledgeable public health experts in your community. In general, the attack rate is higher in larger cities and areas where people more frequently interact with each other. For example, the White House expert Dr. Birx has suggested that the attack rate in New York City may be as much as 5 times higher than in some rural areas. The fourth setting is the doubling interval in days. This defines how many days it takes for the number of cases in your area to double. The best way to determine an appropriate setting at this time is to look at historical data. You can look online to find a reputable source of data. We suggest the website 91-divoc.com, which is updated daily with data from Johns Hopkins CSSE. A link to the site and all of our sources will be provided in the description of the video. The fifth setting is the EMS contagion rate. This is the percentage of your providers that have contracted the disease. The sixth setting is the EMS staff count, where you enter the number of individuals in your department who are available to conduct EMS transports at any given time. For the purposes of our demo, we will suppose that there are 90 EMS staff in Benton County. The final setting is the days to recover setting, which describes how long it takes the majority of individuals with COVID-19 to recover once they have become infected. According to an initial study by the World Health Organization, this is 14 days, but may be lower or higher and does not include individuals with severe and critical cases, which may take between 3 and 6 weeks to recover. For now, we'll leave this at the default. The last two controls on the right-hand side are the operations data and populations data dropdowns. These allow you to select which pieces of information will be displayed on the chart. By default, the simulator displays the number of COVID-related transports, new EMS cases, active EMS cases, and staff fit for duty in your jurisdiction. For operations data, you can also choose to display total number of staff exposures, the number of staff who are recovered, and the number of new EMS recoveries. For population data, you can choose to display the number of people susceptible, the number of contagious people, how many people have recovered, the number of fatalities due to the disease, how many new recoveries there are, how many deaths have occurred, and the total number of people affected. Note that the population numbers will be much higher than the operations data numbers, and so viewing population data makes it difficult to examine the operations data. We suggest looking at them separately. To show this effect, we will briefly add new population cases metric to the chart. As you can see, the peak of the new population cases line nearly reaches 1,600, while the next highest peak is for COVID transports at 151. This makes the chart difficult to read, so we will remove the new population cases line from the chart. The final two controls are the Reset button and the Copy Link to Chart button. The Reset button returns the simulator to its default settings, which can be useful if you've been experimenting with different combinations and wish to return to the baseline. This can also be accomplished by selecting Default from the preset control at the top. The Copy Link to Chart button copies a link to the specific chart you have generated to your device's clipboard and can be used to send the chart to other individuals inside and outside your agency. The next three views are scenario views, which take the settings you have entered as baseline and show you what will happen if those settings are off by various percentages. We'll look at first in the call volume scenario view, which contains a chart showing a range of scenarios describing the number of COVID-19 calls per day using the settings entered on the right as 100% baseline scenario. This chart displays red and green lines showing best case at 85% and worst case at 115% scenarios, as well as showing the line of the worst staffing day for the baseline scenario. In this case, it's day 73. Next is the depletion scenario view, which shows different scenarios relating to staff depletion. The top chart shows the number of staff available on any given day according to the settings on the right. It is similar to the call volume scenario chart in that it displays the best case scenario, worst case scenario, and the worst staffing day. The bottom chart also shows the number of days in which staffing is below a certain threshold for each scenario. The blue bar represents the number of days in each scenario that your staffing level is below 75%. The orange bar, the number of days on which it's below 50%, and the green bar, the number of days in which it's below 25%. The final view is the scenario stats view. This view allows you to see summary statistics and download the raw data for each of the scenarios. You can also download the data as a CSV for use in another tool such as Microsoft Excel. We will view the raw data for the 100% baseline scenario by clicking its Click Here button on the right-hand side of the chart. In order to download the data, click the cloud icon with the downwards pointing arrow in the upper right-hand corner of the chart. This concludes our overview of the Leverum COVID-19 Staffing Simulator. Please don't hesitate to contact us with any questions or comments. You can find our contact information as well as links to the various resources mentioned in the video's description. Thank you again from all of us at Leverum Data Technologies for giving us the opportunity to serve you, your departments, and the people you serve. Thank you. This concludes our overview of the Leverum COVID-19 Staffing Simulator. Please don't hesitate to contact us with any questions or comments. You can find our contact information as well as links to the various resources mentioned in the video's description. Thank you again from all of us at Leverum Data Technologies for giving us the opportunity to serve you, your departments, and the communities you protect.